China's foreign ministry is warning countries that impose restrictions on travellers from China that it may take reciprocal action against them. A number of nations announced screening measures for people travelling from China following a recent surge in COVID infections after Chinese authorities relaxed their zero COVID policy restrictions.
China's foreign ministry says entry restrictions targeting China lack scientific basis and are unreasonable. Foreign Ministry spokesperson Mao Ning says China is willing to improve communication and cooperation with the world to overcome the pandemic, but some excessive practices are simply unacceptable. China's abrupt U-turn on COVID controls and the accuracy of its case and mortality data has come under scrutiny. In response, nations including the United States and France will require COVID tests from those travelling from China, while Belgium will take samples from plain wastewater and test for new COVID variants. European Union spokesperson Tim McPhee says the EU has offered China free COVID-19 vaccines, but did not specify the amount or from which manufacturers. China says its handling of infections in the country is under control. It has maintained its policy of using only Chinese-made vaccines for its own population. It says its COVID-19 vaccine production line, the biggest in the world, has already produced more than 5.5 billion doses. EU government officials are expected to meet on Wednesday to discuss a coordinated approach to the outbreaks in China.
Chinese state media has played down the severity of a surge of COVID-19 infections as the World Health Organization has urged for the country to share detailed data on the virus.
China played down the severity of a surge of COVID-19 infections as the World Health Organization urged the country to regularly share specific and real-time information on the outbreak. Leading scientists advising the WHO said they wanted a more realistic picture about the COVID-19 situation from China's top experts, who are invited to a virtual closed meeting with its technical advisory group on Tuesday to present data on which variants are circulating in the country. It is not open to the public or media. China's abrupt U-turn on COVID controls on December the 7th, as well as the accuracy of its case and mortality data, have come under increasing scrutiny at home and abroad. Some countries, including the United States and France, will require COVID tests on travellers from China. China's Foreign Ministry spokesperson Mao Ning labelled these travel entry curbs as simply unreasonable, saying that they lack scientific basis.
We are firmly opposed to attempts to manipulate the epidemic prevention and control measures for political purposes.
On Tuesday, the People's Daily, the Communist Party's official newspaper, cited Chinese experts as saying the illness caused by the virus was relatively mild for most people. But as the virus spreads unchecked, funeral parlours have reported a spike in demand for those services. China reported 3 new COVID deaths from Monday, taking its official death toll since the pandemic began to 5,253. International health experts predict there will be at least 1 million deaths in China this year. Hospitals are also packed with patients. This emergencies area in a Shanghai hospital was filled on Tuesday, with long queues of patients waiting to be seen. As Chinese workers and shoppers fall ill, concerns mount about the near-term growth prospects in the world's second-largest economy. Expectations for the tourism industry are high for China's biggest holiday, the Lunar New Year, which begins on January 21st this year. Some experts predict infections will have peaked in many places.
Well, for some analysis, we're now joined on the line by a research associate at the African Center for the Study of United States at the University of the Witwatersrand, Gideon Chitanga. Thanks so much indeed for joining us, Gideon. Always good to talk to you. What's your reading of the Chinese Foreign Ministry's warning about retaliation?
I think there are two issues that are quite important to understand. Obviously, I think the response is informed by the sense of the weaponization and the politicization of the pandemic, information around the COVID pandemic, to sully the image of China. One of the major conversations when other countries were opening up was that China's zero COVID policy was disastrous, and there was a lot of criticism from Western media about that position and Western policymakers. Then when China is reopening, the criticism has shifted to the management issues about information availability, which basically relates to the lack of trust between, or the perception of lack of trust from particularly Western governments. It is a fact that, as evidenced by the experiences of lifting of COVID regulations, I think across several countries in the world that that process was followed by a spike, and the spike varied in different countries. So if you consider that fact and consider that China has a population of about 1.4 billion, its cities are massively populated. Surely the magnitude of the spike post the lifting of the COVID regulations would be expected to be comparatively higher. The rest of what we are hearing are concerns about the implications of such a spike. And I think that the focus of the concerns misplaced in the sense of quickly rushing into the negative policy positions, which relates to closing out other populations or Chinese populations from visiting or making it difficult for them to visit. The key issue is it's agreed under the World Health Organization regulations, or at least there is a huge consensus that vaccination is crucial, and China has a 90% level, or has achieved 90% level of vaccination. And immunity is very important in terms of preventing the spread of COVID. Then the other part is simply that the focus of the world or the global community is now more on curing COVID-related infections. Obviously, prevention is very important. So I think the focus should be more on collaboration in making sure that there are no new mutations containing cases, but obviously under the community of the World Health Organization, countries should be focusing on at least collaboratively developing more medicines to cure and contain COVID.
All right. So you've said, and I guess in spirit, that the COVID-19 pandemic has been politicized, and China has been bearing the brunt of this. Are you suggesting that the World Health Organization, who is genuinely calling for statistics from China, is a political animal?
Not really that I'm suggesting that the World Health Organization is partisan. But amidst the noise that is emerging, particularly from the US and the EU, it becomes difficult to also trust the World Health Organization, because it is obviously an institution which previously has been criticized of being biased or of some external influences. So the noise that is politically subjective and skewed towards Western thinking, it obviously plays into the already rivalries and mistrust that is already obtaining, and therefore affects the progressive engagement and dialogue in terms of getting access to the critical information that should be availed, so that the concerned key parties, particularly the big powers which have a bigger responsibility in assisting different institutions in containing COVID, they have the necessary information and they have the necessary trust. Particularly trust, I think, is key when it comes to multilateral relations, in terms of addressing and responding to the pandemic at this level. And I would like to emphasize the fact that the spike is a common pattern. It's not like all of a sudden there's one country that is a new trend of the pandemic. We know from South Africa to every other country, that the lifting of our COVID regulations was followed by a varying level of spikes in COVID infections and a risk of further mutation. And we are talking here about a very big country which has a huge population. So obviously the trend would be different. It would probably be bigger if you compare with other countries. But the basic conditions, the basic structures, the basic systems, and the provisions are available. The key here is to say, if China has domestic conditions that require the world to assist, how can other players help China or cooperate with China in making sure that the bigger risk of other new mutations is reduced? And such a requirement would require a certain level of trust, maybe a very higher level of trust within the World Health Organization and its other institutions, and also between the critical global players and the government of China.
You said that there's some politics around COVID-19. Some might say that this politics played out inside China because they had this zero policy for quite a while. That gave birth to demonstrations across the country, and people are saying that China is backtracking to appease those citizens rather than there being a scientific reason for it, because we have seen this upsurge ever since they lifted the zero policy.
I would say that the pressures that were exerted by COVID regulations, again, they looked more like a uniform template in different countries, and in different cases, they seemed to exert similar pressures, which eventually become unbearable to citizens or populations. The regulations around movement affected global citizens, not only in China, and the pattern around protests was also witnessed in other countries. China was or is one of the last countries to lift COVID regulations, and the explanations around the zero COVID policy was mainly to deal with this unique domestic situation or context that is characterized by a huge population, also a huge elderly population compared to other countries, a high population density compared to other countries, and a relatively higher population density if you compare Chinese cities to other cities. These dynamics required a properly sequenced, maybe domestically flexible kind of approach. And the Chinese authorities are saying they had to sequence the process of lifting the COVID regulations is informed by their own scientific research or their own policy dynamism in response to domestic challenges. So I think that the protests and other things, they are, again, common experiences that we have seen with other countries. The difference, which is probably key in my view, is the size of the country, the size of the population, the characteristics of its demographic. And obviously, in any other country, such conditions would create a different set of difficulties that would require extraordinary domestic interventions, considering that you are dealing with a pandemic which is so fluid, and every other country is thinking about how to protect their own populations before they protect the world. Unfortunately, in this context, we are also dealing with a situation that is geopolitically contaminated by a bit of polarization between big countries, which should be more proactive in working together to address this problem.
All right. So South Africa has said it's not going to impose any restrictions on travellers from China. So you'd say that this is the right call then?
I actually think that there isn't any need to resort to restrictions. I think if it was an African country, I would openly say such restrictions are racist. And I think even in the case of China, they are primarily motivated by other ulterior motives other than clear policy considerations that would be informed by clear health interventions to combat this situation. So South Africa is taking a proper position. The key is to continue to open conversations and global dialogue in terms of having a good understanding of the domestic conditions in China and looking at how, if there is need, other countries may work with China to make sure that the current conditions within the country are dealt with effectively, and the COVID pandemic going forward is also addressed permanently.
Gideon Chitanga, thank you so much indeed for joining us. Your insights greatly appreciated.
Thank you.
Right. Thank you. So Gideon Chitanga saying that the reaction that the European Union and other countries placing restrictions on travellers from China is of a political nature and not based on science. That's the word coming out of China. And their response is that those countries that impose restrictions will also find retaliatory measures and having restrictions on them.